Hey everyone, it's Dr. Alessandro. Welcome back to my channel. So in this video, what I'm going to be explaining a bit about is how frequently you should get dental x-rays. Now, I want to let you all know that what you do with your body and procedures is entirely your choice. And that also pertains or applies to x-rays. So you can choose to have x-rays done when you come in for your dental checkups or visits, or you can say no. You can do the same thing if you have a dental emergency. You can choose to get an x-ray or you can choose to say no. But I do want you to realize that if you as a patient choose to say no and do not want a dental x-ray, then we as your dentist cannot provide you with a definitive diagnosis. That is, we can't tell you officially what's wrong. We can just make a guess. So if you have a tooth that's hurting and it looks fine on the surface, but you know it's that tooth that's hurting and our other tests suggest that it is the tooth that's hurting, if you say no to an x-ray, we can just say, hey, the tooth looks okay, it feels like it's bothering you, and our tests say that it's bothering you, but we can't tell you what exactly is going on. So you're kind of taking one of the most important tools that we have, if not the most important in certain circumstances. You're taking it away from us. So it's like asking a carpenter to measure something just using his or her eyes and not being able to use an actual, say, ruler or any other instrument used for measurement and say, okay, I want 1.5 feet or 1 5/8 inches, and can you cut that precisely with no measurement, with no ruler? You might get something that's close if you have an experienced carpenter, but you're probably not going to get the exact measurement or dimension that you wanted. Same thing here with us. I mean, you can get a very educated guess, but we can't tell you in some cases definitively what's going on without an x-ray. We can't tell you 100% of the time what's going on. So it is important for you to let us get x-rays, certainly at emergency visits, but also routine x-rays. I just had a patient who came in and she has refused cavity checking x-rays. One of her teeth broke. As I looked into the tooth, I could see a fair amount of cavity or decay. And I said, look, this has probably been brewing for quite some time. And she then proceeded to ask me, well, if I had said yes to getting checkup x-rays in the past, would you have been able to see this? And my answer was, yes, I would have been able to see that. Because now we're in a situation where we could not remove all of the decay. We could just put in a temporary filling. And it may end up becoming a root canal for the nice young lady, or end up becoming an extraction, whatever the patient chooses to do. So this is really, really important. I do recommend getting your regular x-rays and listening to the advice of the dentist. Now, everybody has his or her own, let's just say, needs for dental x-rays. So for some people who are more cavity prone, it's probably best to get x-rays every year, because we want to stay on top of the disease and not fall behind or have to catch up or end up with a wildfire if you decide to go 2 or 3 years without x-rays. So for people who have had a lot of cavities in the past or who have a lot of fillings and crowns, so even if you're in good shape as far as not really having a high rate of decay at this time, but you've had a lot of dental work done in the past, it is a very good idea to get routine x-rays so that we can basically monitor and see how things are going and if everything is holding up well for you. Because even then, if you say no and then something breaks down, we may not know visually. Everything may look just fine to our eyes and with our instruments, but there could be something brewing that we could stop before it becomes a really big problem. So for people who are more cavity prone or have had a lot of dental work done, it would be wise to get x-rays every year. If you're like me and you've only had a limited amount of work done, very limited, and you're good with your home care, sometimes even 2 years is good. Every other year getting x-rays. And if you've never had a cavity in your life, ever, For some people, we can even push it out to every 3 years, depending on the case. Now, that's a pretty rare circumstance, but you'll find that dentists who are conservative and who follow the guidelines will recommend every 3 years up to a certain point. So now, what I can do, I can even show you my own x-rays and show you why I personally do every other year as my own guideline. So hang tight and I will show you just that. So as you can see, these are my x-rays. This is my mouth. You can see that I have had one filling in the past on the upper right, and it's a silver filling. And we'll discuss more about dental materials in the future, but that filling right there has been there for nearly 20 years and it's doing very well. So I'm not in any rush to replace it. It's done a wonderful job for nearly 2 full decades. But you can see from my x-rays, otherwise I've got decent levels of bone. For those of you who are experienced in looking at dental x-rays, you can tell that I'm a clencher or grinder because my teeth are pretty much flat. I would clench my teeth or grind them at night. So, yep, my teeth are now worn pretty much flat and smooth on the tops of them. But really, otherwise, there's nothing remarkable going on. So, I personally, because I've had one filling in the past, in between the teeth, I put myself in the every other year category. I've got good home care. I brush my teeth. I floss almost every single day of the year. And I tend to keep things clean, and I'm a low decay rate type of person. But, some people are high decay rates, and those folks I would recommend getting x-rays done, every year, or maybe every year and a half, depending on the case. So that's a little peek or preview into dental x-rays and why we should do them and how frequently we should do them. Stay tuned because you may see these x-rays in the future for other videos, possibly even clenching and grinding, or maybe, like I said, about different dental materials. So again, thank you so much for joining me on this video where I discussed why we should do dental x-rays, how frequently we should do them as far as that's concerned, and what it means for you to let us do the x-rays or not let us do the x-rays. So again, remember that without an x-ray, we can't give you, the patient, our definitive diagnosis. We can just say, I have an educated guess. And that sometimes dental x-rays can pick stuff up that can potentially really save you all time and money. It can let us catch stuff when it's small instead of having to end up fixing stuff that could be really big or really expensive or even lead to loss of a tooth. Again, thanks for joining me. Hope you're all staying well and healthy. And if you like our channel, please like and subscribe to it. And look forward to seeing you in the future.